SA Medical Association says it's concerned that at least 800 qualified doctors in the public health sector are unemployed due to budgetary constraints. This comes as the country faces a dire shortage of doctors. Some medical unions say qualified doctors are leaving the country because there are simply no jobs here. Let's unpack this with the Medical Association's chairperson, Dr Mvuyisi Mzukwa, who joins us now via our video link. And Dr Mzukwa, it's great to have you on the program as always. Thanks very much indeed for making time. And this is certainly not a new story. I mean, there's been this contrast, if you like, where on the one hand, we're in desperate need of doctors, and on the other, there are qualified doctors who are sitting at home. The question is, why haven't we been able to reconcile these two things, despite how long-standing this issue has been?
Good morning to you, Ayanda, and to your listeners, and thanks for having me. Ayanda, I think the problem is, poor planning. You know that there's an HR policy that is gathering dust, that stipulates how we should be planning, or implementing, to make sure that we have enough health personnel on the ground. But also you'll have noted that over the years, the budget for healthcare has been going down at least by 1%. So, that knocks, the challenges that we have are still unattended to. So that is where the problem is. The other thing is, government has always been concealing, the number of posts that are available there, because if a doctor who's been working, with government retires or they go to private, whatever the case is, they simply erase that post. And if you look at their records, it will seem as if they have 0 vacancies for the state. But actually, if you look according to the organogram, there's quite a lot of vacancies that are not filled by the government.
And no matter how you see it, the lion's share of the health burden in this country is still very much in the public sector. And that's why, Doc, we've seen so many harrowing accounts of the kind of experience that specifically junior doctors have faced as they enter this particular space. Part of the reason is because they're so overworked, so stretched, and quite literally worked down to the bone. None of this bears well for the health sector.
Yes, you'll recall that there's 2 categories. There's one internship that you qualify at medical school, go for your further training for 2 years. That's medical internship. Thereafter, you go for community service. That's about 1 year. So that's not a problem because the state is obligated by its own legislation to place those doctors, in the public sector. But when they qualify after community service, they are full qualified doctors, independent. They can work independently. Then the state tells us they don't have money. But recall that, in the state, there is a dire shortage of healthcare workers, especially doctors. It was highlighted by the minister in parliament. And we all know that in the needy areas, like the rural areas, we still have a dire shortage. Not only those categories, but also specialists. People who have already finished specializing, immediately after they qualify, they don't have a space in the state. So they have to go private, or some of them remain with their medical officer posts. So this is a serious problem for the state, because if you look at it, at the end of the day, they have a tendency to, scapegoat and blame doctors and say they are leaving the state and going to the public, but to the private sector. But look at it now, they can't absorb those doctors trained. What they do, they go to other countries, or they go private. But the problem is, you are leaving the public healthcare sector in a dire state, because there is a dire shortage of staff, and those that are remaining behind are overworked.
Yeah.
There's burnout, there's everything that you can mention around, those are remaining behind.
And of course, part of the, the consequence of that is that there's a chilling effect, right? other doctors see doctors in the public health sector being burnt out, and of course they opt for other posts if in fact they have that option. But I've got an article in front of me where the acting director general of the health department is being quoted as saying here that they always put out vacancies. In fact, almost insinuating that it's doctors who have qualified not registering with the Health Professions Council of South Africa that seems to be where the bottleneck is, if you like. This is my interpretation of this article. If that is accurate, is it fair?
No, it's not fair. In fact, it's very misleading, Ayanda, to say the least, because those doctors have got their registration numbers from HPCSA. Now, we're not talking about hearsay. We're talking about the database that we have. These are people that you can verify with the HPCSA. They are already, from the working environment. How can they not be registered by the HPCSA? So the problem is you have people who, when they come out to the media, they want to protect their bosses, because you must remember all that they're talking about are just employees of the department. The truth is there are doctors in our database, that are not employed, and they are fully registered by the Health Professions Council. So even if you were to say, give me that list, we could give you that list because we do have it.
One of the big issues, without a doubt, that's going to be a talking point as we head into 2024 is going to be NHI. So much discussion around whether or not we're ready for it, whether or not, in fact, it's going to move us forward, or if we're going to regress. I wonder to what extent you reckon NHI in its current form will at least address this problem?
Well, we know that the NHI would require enough personnel on the ground. There's no way that you can have universal coverage without employing enough personnel on the ground, healthcare workers, making sure that all the areas, the rural areas, have got healthcare workers. And there's no way that the NHI is going to be paying for the employment of those healthcare workers. All they do is that they purchase services, just like you do with the medical aid. But they won't be building any hospitals. They won't be employing any doctors. So the state has the chance now to capacitate the healthcare system now, so that by the time they try and implement the NHI, at least they have something that they've done. As it is now, we don't have, that our buildings are dilapidating. We've got broken machinery on the ground. In fact, the environment is not convenient for anything. Even healthcare workers at times, they want to leave the space because it's actually very inconvenient or not conducive for a healthcare worker to be doing, their proper job there, which leads to litigation, by the way. And we're sitting at around 120 billion of litigation in the country.
Absolutely. It's certainly a multi-layered problem, and one wonders the impact it has on the standing of the profession. Dr. Mvuyisi Mzukwa, as always, thanks for your time. Really do appreciate your speaking to us. Dr. Mzukwa is the chairperson of the South African Medical Association.